The first wrinkles tend to appear on a person's face in areas where the skin naturally folds during facial expressions. They develop due to the skin becoming thinner and less elastic over time. Wrinkles also tend to appear on parts of the body that receive most sun exposure, such as the face and neck, back of the hands, and arms. Wrinkles are a natural part of growing older, and they affect everyone. However, many people dislike the appearance of wrinkles, and, as a result, the anti-aging market in the United States is worth over $50 billion per year. How your skin ages will depend on a variety of factors: your lifestyle, diet, heredity, and other personal habits. For instance, are you a smoker or did you ever smoke? Smoking can produce free radicals, once healthy oxygen molecules that are now overactive and unstable. There are other reasons, too. Primary factors contributing to wrinkled, spotted skin include normal aging, exposure to the sun, photoaging, and loss of subcutaneous support, fatty tissue between your skin and muscle. Other factors that contribute to aging of the skin include stress, gravity, daily facial movement, obesity, and even sleep position. Wrinkles are a natural part of the aging process. As people get older, their skin becomes thinner, drier, and less elastic, which means it is less able to protect itself from damage. This leads to wrinkles, creases, and lines on the skin. Facial expressions, such as smiling, frowning, or squinting, lead to the development of fine lines and wrinkles at a young age. These lines deepen as the person gets older. When a person is young, their skin springs back. As they get older, the skin loses its flexibility, and it becomes more difficult for the skin to spring back, resulting in permanent grooves. Wrinkles affect people of different skin tones differently due to structural and functional differences in the skin. Many factors affect the development of wrinkles, including sun exposure, smoking, dehydration, some medications, environmental and genetic factors, exposure to ultraviolet (UV) light from sunbathing, tanning booths, and outdoor sports increase the development of wrinkles. UV light breaks down the collagen and elastin fibers in the skin. These fibers form the connective tissue that supports the skin. As this layer breaks down, the skin becomes weaker and less flexible. The skin starts to droop, and wrinkles appear. Darker skin contains more melanin and protects from many harmful effects of UV radiation. People who work in sunlight have a higher chance of early wrinkles. Wearing clothes that cover the skin, such as hats or long sleeves, may delay the development of wrinkles. Regular smoking accelerates the aging process of the skin because it reduces the blood supply to the skin. Alcohol dehydrates the skin, and dry skin is more likely to develop wrinkles. Skin changes that come with age: skin becomes rougher. The skin develops lesions such as benign tumors. Skin becomes slack. The loss of the elastic tissue, elastin and collagen, in the skin with age causes the skin to hang loosely. Skin becomes more transparent as we age. This is caused by thinning of the epidermis, surface layer of the skin. Skin becomes more fragile as we age. This is caused by a flattening of the area where the epidermis and dermis, layer of skin under the epidermis, come together. Skin becomes more easily bruised. This is due to thinner blood vessel walls as we age. Photoaging: over time, the sun's ultraviolet (UV) light damages certain fibers in the skin called elastin. The breakdown of elastin fibers causes the skin to sag, stretch, and lose its ability to snap back after stretching. The skin also bruises and tears more easily and takes longer to heal. So while sun damage may not show when you're young, it will later in life. Nothing can completely undo sun damage, although the skin can sometimes repair itself. So, it's never too late to begin protecting yourself from sun exposure and skin cancer. You can delay changes associated with aging by staying out of the sun. Subcutaneous, below the skin, changes. Loss of fat below the skin in the cheeks, temples, chin, nose and eye area may result in loosening skin, sunken eyes and a skeletal appearance. Bone loss, mostly around the mouth and chin, may become evident after age 60 and cause puckering of the skin around the mouth. Cartilage loss in the nose causes drooping of the nasal tip and accentuation of the bony structures in the nose. Other skin changes: gravity, facial movement and sleep position are the secondary factors that contribute to changes in the skin. When the skin loses its elasticity, gravity causes drooping of the eyebrows and eyelids, looseness and fullness under the cheeks and jaw jowls and double chin, and longer ear lobes. Facial movement lines become more visible after the skin starts losing its elasticity, usually as people reach their 30s and 40s. Lines may appear horizontally on the forehead, vertically on the skin above the root of the nose glabella, or as small curved lines on the temples, upper cheeks and around the mouth. Sleep creases result from the way the head is positioned on the pillow and may become more visible after the skin starts losing its elasticity. Sleep creases are commonly located on the side of the forehead, starting above the eyebrows to the hairline near the temples, as well as on the middle of the cheeks. Changing sleep positions may improve these sleep creases or prevent them from becoming worse.